when you said every case is as good as the first case, because that anxiety is always there because somebody's life is in my hand.
Do you pray before every surgery?
Every surgery I pray. Yeah. I don't talk to anybody before going to theatre.
Oh my God.
Yeah, I don't look at anybody. See, there are two arteries in the heart, one on the left, one on the right. The left divides into two. 70% of blood supply of the heart is by the left side and the 30% is by the right side. So if there are multiple blockages in all three arteries, different positions, which are more than 70%, then there is no point in putting multiple stents in all three arteries, because the incidence of reblockage in multiple stents is very high. So in these cases, we always try and do CABG as a first option. Reason for do bypass is diabetic patients, small vessel disease, diffuse disease. In those patients, bypass is the best option. Our success rate in bypass is 99.56. So that is
a patient question that you have been asked 100 times but never get tired of asking.
Why me?
Which is the denial.
And second thing is, मला काहीच त्रास होत नाही. They are always in a state of denial. They don't want to get convinced on. I will require this angioplasty or bypass.
मुझे तो कुछ हुआ ही नहीं था. मैं तो ठीक था.
I was normal. If you ask them, because if you had a heart disease, if you had a bypass or angioplasty, your next generation will have this disease 10 years earlier, a decade earlier. So what you should do is, eating habits should be improved. At home, if you are using oil, try and use only half a liter of oil per person per month. Say no to white, that is dairy products, no to green, and exercise is the most important thing. Every day, at least 5 days in a week, you should be exercising whatever suits your body. Walking 5 kilometers in 45 minutes is the best exercise for the heart. If you want to do cycling, you can do cycling. If you want to do swimming, you can do swimming.
Hi. Today we are talking about one of the most critical and complex procedures in cardiac surgery, coronary artery bypass grafting, also known as CABG. A race against time where every stitch, every second and every heartbeat counts. It's a high-stakes surgery that cannot afford any error, performed only by those with unmatched precision, experience and nerves of steel. So how does this life-risking, life-saving procedure actually works? And what does it take to do it right? Let's explore the intense world of CABG. Joining us today is Dr. Rahul Kaiche, an eminent cardiovascular and thoracic surgeon renowned for his precision, innovation, and life-saving expertise. Trained under the legendary Dr. Neetu Mandke and with international exposure in London, Oxford, and Melbourne, Dr. Rahul Kaiche has performed over 12,500 plus successful surgeries, including some groundbreaking, high-risk pediatric surgeries. He is the only surgeon in North Maharashtra regularly performing both mid-cab, which is minimally invasive, direct coronary artery bypass, and total arterial CABG, which is coronary artery bypass grafting, boosting a remarkable 99.66% of success rate. A gold medalist and recipient of multiple prestigious awards, Dr. Rahul Kaiche is also a pioneer of fast-track cardiac recovery in India. You are about to hear from a true leader redefining the standards of cardiac care. Welcoming Dr. Rahul Kaiche, the man with magical hands. Hello and welcome to Sahyadri Health Talks. I'm Dr. Tushita and today we have with us Dr. Rahul Kaiche, and I favoritely call him man with magical hands. How are you, sir?
I'm good, thank you.
Welcome to Sahyadri Health Talks, and this podcast was waiting for you.
I was waiting for you.
We are so happy to have you today. So, how are you and how are things at your end? I'm pretty sure that being a Sunday, I've taken a lot of time of yours. So
it was yesterday was a spiritual day for me, and I have been to Shirdi.
Oh, nice.
And then nearby temples there. So I came back early morning 5 o'clock.
And I'm glad that you could give us some time. So before we dive into today's topic, which is CABG, I have wanted to ask you this one question. That you have been performing these surgeries over so long, and I think the only thing that you think the entire day which runs in your mind are these surgeries. So, do you still remember your first surgery which you did?
My first surgery I did in my training day, that is in KM Hospital, Mumbai, when I was doing my MCH cardiac surgery. And I think Dr. Tendulkar was the first person who made me do my first cardiac surgery. So he is one of the best teacher I have seen in the world. He was making me do that surgery, and I cannot forget that day because it was my first time dealing with the heart directly.
धक धक हो रहा था सर?
Not dak, it was more of excitement. My first journey in cardiac surgery started. So, and that patient did very well. I know her. She was a lady about 26, 27,
अच्छा
unmarried. So we had done her mitral valve replacement.
अच्छा
And it was a memorable day for me. So,
So,
my
sir-
journey of cardiac surgery started from there.
अच्छा तो अभी होता है सर धक धक?
Every patient,
Do you feel excited? So what I wanted to ask you is, do you feel that same level of excitement before doing every surgery?
it is always there. Otherwise, I would not have been operating 4 or 5 cases in a day. It is a passion for me. Like
4 or 5 cases in a day.
Day,
you say?
yeah.
Oh my God.
I had done about 6 cases in a day. In
Wow.
6 on Saturday and 5 on Sunday. That is 11 cases in 2 days we had done.
Wow.
That was not here in Nasik. It was in Jalgaon.
अच्छा.
It was a single center, a single operation theater.
Uh-huh.
And we managed to do 11 cases, and all of them had 3 grafts, except one patient who had 2 grafts.
Uh-huh.
So when you said every case is as good as the first case, because that anxiety is always there because somebody's life is in my hand. So I always feel how I don't know how this case will go, but I'm confident of
That you
doing
will give your
yeah,
best.
best.
So
If that thing is not there in you,
Uh-huh.
of anxiety or whatever you call it, you won't deliver a good result because then you will take things for granted. And I think in cardiac surgery you cannot take anything for granted. Anything can go for a toss during surgery.
Yes.
So you have to be mentally prepared for it. And if you're mentally prepared, if you're anxious, if you're grounded and at peace, most important thing, then you can handle anything.
So as you said कि आप कल शिरडी गए थे, so I already know that you are quite a spiritual person. So do you pray before every surgery?
Every surgery I pray. Yeah, I don't talk to anybody before going to theater.
Oh my God.
Yeah, I don't look at anybody
अच्छा.
because I pray and I directly go to theater. Try and go to theater directly unless there is some dire emergency.
हाँ हाँ हाँ.
Otherwise, I am giving my best to that patient because his life is in my hand. He is surrendered to me. So the way you surrender to God,
Yeah.
so he surrendered his life to me. So I got full responsibility of his in my hand. So I don't think I should get distracted or get annoyed or get disturbed by anything before going to theater.
So that's lovely. So starting on today's topic, which is CABG. So how do we decide the treatment plan? Whether the patient needs a CABG or because I'll tell you why I'm asking you this, because there's a lot of talks which are happening around the stent that cardiac arrest, heart attack cases, stent डालना पड़ा, कुछ patients को CABG करवाने पड़े, but for a layman ये काफी confusing होता है कि किस patient को CABG की जरूरत पड़ती है, कब CABG की जरूरत पड़ती है. So if you can help us understand that part.
I will discuss in short about this. It's a very important question. See, there are 2 arteries in the heart. One on the left, one on the right. The left divides into 2. The 70% of blood supply of the heart is by the left side and the 30% is by the right side.
अच्छा.
So if there are multiple blockage in all 3 arteries, different positions, which are more than 70%, then there is no point in putting multiple stents in all 3 arteries because the incidence of reblockage in multiple stents is very high.
अच्छा.
So in these cases, we always try and do CBG as a first option because the reason being we don't do anything to the blockage. We put a new graft, what we call as a new vessel, way beyond the block where the artery is normal. So even if the blockages get increased, the place where you put a graft, which is normal, it will keep running the blood. So the incidence of failure is very less. Hence, the bypass failure is very less as compared to angioplasty.
Okay.
Second reason for do bypass is diabetic patients, small vessel disease, diffuse disease. In those patients, bypass is the best option.
अच्छा.
Third is, I said there is a left artery. So left artery, which is a main artery, dividing into 2. So anything which is involving the left main, जो मेन आर्टरी होती है उसको नहीं तो
involve
जहाँ पे
करते हो।
बाइफर्केट हो रही है वो इन द टू, तो एट द ओरिजिन, बोथ ओरिजिन देयर आर ब्लॉकेजेस. देन if you have learned physics, so whenever the blood is flowing from one to the two vessels, there is a turbulence there.
Yeah.
So what in our medical term is called a Virchow's triad. So
Acha.
turbulence, stagnation, and clotting.
Acha.
So these things comes into play. So when you are putting a stent at the origin, there is always a turbulence. There is always a incidence of platelet aggregation.
Acha.
There are platelets of the cells in the blood which help in clotting. So they get stagnated there, and then you can form a failure. Stent failure is the reason for stent failure is ostial stenting, left main to LT stenting.
Acha.
I'm not saying we cannot do left main to left main stenting, but the first priority should be given for bypass because the patency of the grafts, if you are using mammary arteries, is quite high. And third reason being, even if it is single vessel disease, which is 100%, in those cases, if it is 100% blocked, most of the time they cannot be opened up by angioplasty. So we advise bypass for this patient.
Acha. So these are typically the three reasons why.
These are three direct indications
for bypass. So, sir, we have heard about stents, and there are a lot of advancements which has come in stents also. When it comes to CABG, how technology and advancements have made CABG more safer options for patients is one. First, my question, and second is how is it also helping the surgeons?
See, there are two kinds of advances: technical advances and technological advances.
Acha.
Technical is surgical skills or surgical practices or different ways of operating.
Acha.
So initially when we started cardiac surgery in my days, all the surgeries were done on pump. It is using heart-lung machine.
Acha.
But nowadays I don't think anybody is doing bypass surgery using heart-lung machine. They are beating heart surgery. Acha. This is one of the basic advancement. Then suture quality, the drugs which are using for anesthesia, anesthesia techniques, anesthesia drugs, everything is advanced. Initially, patients were ventilated in the ICU for almost 12 hours or maybe the whole day, and then next day they were taken off the ventilator. So now patients are taken off ventilator immediately after surgery, maybe 1 or 2 hours after surgery. So these are all advances in anesthesia. Similarly, the advances in surgery have definitely decreases the risk of complications in bypass surgery, like pitting heart surgery I mentioned. Then the quality of sutures have improved. Thirdly, this robotic surgery has started coming in. Minimal invasive cardiac surgery has started.
Yes,
So with all these techniques, the pain has come down, the stay in the hospital has come down, the incidence of bleeding has come down. So this has definitely helped to improve the results in bypass surgery. Now, if you ask me my results in bypass surgery, our success rate in bypass is 99.56. So that is better than international standards. The only reason being this is technique and the teamwork. Team is very important for giving results. I have got a very good team in my hospital. That includes myself, the associate cardiac surgeons, the anesthesia and his team, the ICU and his team, the ward and its team.
Definitely, a team.
And the physiotherapist.
The build-up of the team definitely is very important. So as you spoke about the risk factors, right? So there are certain category or age group of people like the elderly, people with comorbidities, as you said. So how do we, analyze the risk versus the benefit out of CABG?
There is a score called Euro score. Any patients who comes to us for bypass surgery. So we analyze his risk factors by considering his age, his diabetes, his hypertension, his sex, male or female, the incidence of complications are more in females. Then the ejection fraction, heart function, how much is heart function, the kidney function, all these factors are including the history of heart attack. So all these factors are taken into consideration, and then we get a score. The score, depending on the score, we tell them the risk involved. Suppose the Euro score comes as 1.5, so the risk is 1.5. The Euro scores come to 20, then the risk is 20%. So any patients who comes to me in the ward, so I look at him as a patient as a whole. When he's walking, how is he walking? How is he mentally, physically, and how is he sitting? How is he getting up from the chair? So that gives me the idea how will he behave after the surgery in the ICU and in the ward. How will he recover? Even mental status is very important. People who are 80, they look like a 60. and those who are in 60s, they look like 80. So it is not the age which matters. Age is just a number. It is your patient's mindset, how physically and mentally strong he is. He should be demanding surgery. He should be telling me. I explain to them everything. What are the risk factors? What are the advantages? What are the disadvantages? How is he going to behave after surgery? Immediately after surgery, then in the ICU, and how is he going to go in the from the ward to home?
Acha.
So when I tell him, this is the risk involved, and if you are ready, we'll go for surgery. You have to be asking for surgery. Patient has to demand for surgery. He's a patient.
So half of the battle is won there.
So when he says, "Nee, Dr. Kaiche, I want to go for surgery," so I know he'll go home easily. So it is not the risk factor. Risk factors, of course, they tell us how much patient will be in the ICU, but it is all patient's mental framework which matters, and how is the surgeon giving the confidence to the patient of getting up faster.
Okay.
So even if the patient is sick and I feel he's very mentally strong, then we go for surgery. And it doesn't matter if his heart function is 15% or 10% or 20%. We operate more than 1,000 patients with heart function less than 25%.
Oh, is it?
Yeah. And among those groups, our results is almost 100%. Because we give 100% to the patient, the ICU, everything. We don't let anything happen. And the key thing for this kind of patient, the surgery is quick in and quick out.
Acha.
So the surgical time should be as less as possible. You should get him to theatre, operate as fast as possible. So the less the surgical time, less the incidence of complication and infection, renal failure. And you should be trying to do maximum grafts for this patient.
Acha.
Not 1 or 2 grafts, it should be 3 or 4 grafts because he has to benefit maximum. And as fast, normally in this kind of patients, I finish the surgery in 1.5 to 2 hours time. And that gives a faster result.
Okay. So you are saying basically the shorter the time spent in the operation theatre, the better are the chances of the patient to...
For sick patients.
For sick patients. And the patients who are walking into your OPD, I mean, the stronger the willpower, the better is the
result.
Outcomes. Yeah. So how does this post CABG recovery, if I have to ask, because what is most of the time what these patients think is कि CABG की सर्जरी या फिर कोई भी सर्जरी होती है, सर्जरी के बाद के जो टाइम स्पैन होता है,
हमको बहुत टाइम क्या, it will be second life for us. This is what they say.
Yes.
Which is a myth. See, cardiac surgery करने क्यों है patient, bypass करने क्यों है, to get better.
हाँ जी.
So if I am not able to make him do what he was doing before having a heart attack or before having a heart disease, then there is no purpose in operating.
Correct.
So when my patient comes to me, there are 2 reasons we operate for bypass.
Achha.
One is to decrease the symptoms, that is taklif kam karne ko, and second is to improve the life quality and improve the lifespan.
Achha.
So these 2 reasons we operate. See, if I'm not able to deliver in these 2 things, then I will say don't get operated. If I'm not going to deliver take his symptoms down, or the risk of sudden cardiac death or increase his lifespan, then no point in operating this kind of patients. So this kind of patients we say, ki, live a life whatever you have. I'm not a god, and I can't change his destiny as such. I can of course improve his symptoms and decrease his symptoms and increase quality of life. So normally when we patient operate today on day 0, day 1 we make the patient walk in the ICU.
Achha.
Day 3, day 4 we shift them to wards. And day 5, day 7, 99% of patients go home walking half a kilometer, climbing 2 flights of stairs. This is what 99% of patients.
Wow.
And when they go home, they have to walk half a kilometer every day. They have to climb 2 flights of stairs every day. And second thing is increase the walking by half a kilometer every week. So target is by 3 months you should be walking 5 kilometers.
Achha. Yeah. Okay, so as we are talking about post recovery, so there are many people watching this podcast who might have undergone a recent bypass. So what one message that you want to give out to them?
Try and live a normal life. Forget we had operation. Try and live a normal life, because आप कोई लड़ाई करके घर पे नहीं गए, आप ऑपरेशन घर पे गए हो, और ये सर्जरी तुम्हारे कर्म से तुमको लगा है.
Okay.
So at your family members, especially your wife or your kids, they are not responsible for your surgery. So when you go home, ये इंडियन मेंटेलिटी है, घर पे जाने के बाद सोते रहने का, वाइफ पाँव दबाती दे रही है,
अच्छा
लड़का लोग उसको हेल्प कर रहे हैं टू गेट अप फ्रॉम द बेड. दिस इज ऑल बुलशिट, humbug. In UK, I never seen patients being helped by the relatives. Most of the time, the relatives are not there also.
Yeah,
They are doing
that's
of their own. So
That's true.
here the relatives make the patient. They don't make him recover only. Because they will make him sleep in the bed only. I advise them sleep 2 hours in the afternoon and sleep 6 to 8 hours in the night time.
Okay.
Rest of the time, keep moving around, keep doing your normal activities. The only thing we don't advise is you don't lift more than 3 kgs of weight,
Achha.
and don't drive two-wheeler for 3 months and 4-wheeler for 6 weeks.
Achha.
That is the advice we give. Otherwise, he has to.
So this is the
suppose if
only
it's a-
restriction
yeah,
that they
and
have.
suppose this is an office goer. Most of the patients who are office goer doing a desk job, they have
Hanji.
been joining their job in 15 days to 3 weeks time.
Are wonderful.
Unless it is a hard work job,
Achha.
like lifting more than 3 kgs of
Which
weight.
requires a lot of physical
Then those
strenuous.
patients we advise you don't lift heavy weight till 3 months from the date of surgery. After 3 months, he can do whatever he was doing. Like he can do Surya Namaskar also. I got a patient who's been climbing this mountain for after 3.5 months
So
of surgery.
trekking after
He's been doing
CABG.
trekking. Yeah.
Oh,
He's been
lovely.
doing trekking. There are many patients who are doing trekking. They are doing Surya Namaskar after 3 months of surgery. There's a
Achha.
patient who's a IAS officer who does 108 Surya Namaskar. He did last yoga day.
Oh, wow.
So it's a myth among the people की bypass झाल्यानंतर patient अधू होतो.
अच्छा.
My life becomes hampered. I cannot do normal activities. It's all myth.
क्योंकि बाईपास कर ही गई है आपकी क्वालिटी
To
ऑफ
make
लाइफ
him-
बेटर
yeah, to
करने
make him
के
better,
लिए
yeah.
तो आप अगर बेड पे पूरा दिन लेटे रहोगे then how is
He is
it
not going to recover.
He's
He'll
not
remain
going
patient
to.
lifelong.
Yeah. So now, just pulling it back a little back towards the treatment modalities and the technology and the technical aspect of it. How much contribution has AI? Because AI is in talk everywhere. मतलब everything, everywhere, अभी AI आ गया है. So what is the role of AI in making these surgeries better?
I don't think right now we got any inputs of AI in cardiac surgery to make it better. Of course, AI inputs we can take in OPDs.
अच्छा.
Yeah, giving appointments through a AI software or sorting out the patient's data. Those things we can definitely get the AI help. In fact, I am trying to develop a software with one of my friend who's developing a software for patient's appointment, patient's symptoms. Like when they come in the OPD, the AI will tell them everything about what disease he's got and what treatment modality is available, what treatment he's going to have. When he comes to me see me, beforehand he knows everything about cardiac surgery.
Acha. So it's probably helping in the diagnosis and the planning the treatment part of it. So before I move on to the next segment, I wanted to know and hear a bit of stories from you. I'm very sure you have a lot of stories. So एक कोई कहानी सुनाइए सर जो आपके लिए बहुत चैलेंजिंग था, a case which was very challenging for you and which made you really feel great about choosing this.
See, there are not one case, there are many cases. And as I said, every case is a challenging case for me. I consider it a challenging case for me. But one case I will say it was among the cardiac surgery, it's called a supraimagous cardiac surgery.
Acha.
He was a young chap, about 34-year-old, known to me actually. And he had a aneurysm of the ascending aorta. That's what we call as the aorta pipe which comes from the heart, which call as the ascending aorta. It is normally around 3.5 centimeter maximum. So it was around 5 to 6 centimeter, and then it was involving the neck vessels also and the thoracic aorta also.
Okay.
So whole pipe was quite aneurysmal, and he was told surgery, but I think he came late and he had a rupture of that pipe. So we had to replace the whole pipe, including the wall, including the neck vessels, including the pipe lower down. So whole body of the whole pipe was to be replaced, and this is a quite supraimagous surgery. And we started him around morning 10:30, 11. I think he came early morning, and 10:30, 11 we started him, and it went on till 4:30, 5 o'clock. The risk in this kind of patients is heavy bleeding
Acha.
or death on table itself. Plus, we are replacing the neck vessels also. So, if your surgical time is long, then he can have a stroke post-operatively. He can have paraplegia also post-operatively. All these things are taken into consideration from anesthesia point of view, surgical point of view. Teamwork is very important, this kind of
As you
surgery.
said earlier also.
So we managed to send this patient on day 6, I think. He went home on day 6 and he did very well. And being known to me, so there was a lot of pressure ki, like relatives say ki nahi, Rahul is there, our doctor is there. They don't understand the pressure which I am going through. They don't want to know also how much is risk involved. You are there not to take care of it. So as if I am the whole and soul. So that stress was also there. And
Yeah.
second was my own uncle, whom I had operated about 8 or 9 years back.
Acha.
Again, he had a heart function of only 20%.
Okay.
His heart was quite big, not moving at all. He had 2 arteries which are 100% diabetic. His creatinine was very high, 2.2 creatinine. Kidney functions were on the lower side. And same thing, my father, my uncles and my aunts and everybody, Rahul is there. Rahul is there. But
So,
they
sir,
were
how do you
understanding.
deal with this part of it, where there's tremendous pressure from you? Both the cases which you said, right? The first one was your known patient, and it was a word of mouth which came to you, and the second one is family. So, when you are under such tremendous pressure, where the
I
person
operated
doesn't
my
want.
father also. For,
Okay.
not for cardiac surgery, for some
Acha.
other surgery, lung
Acha.
surgery.
Acha. So, how do you deal with this?
I consider him as a patient.
Acha.
I don't consider him my, because to me, every patient whom I operate, I consider him as my father, mother, brother, sister, or uncle, aunt. So when you consider that patient is your own relative, you have to deliver 100%.
True.
So as I said, every patient I have got anxiety, कैसा होएगा, कैसा होएगा, ये रहता ही है मन में.
वो तो
जो जिस दिन ऐसा चला जाएगा, ये कैसा होएगा, क्या होएगा, then I think I cannot deliver the best results.
बर्नआउट
because-
फील होता है सर आपको? बर्नआउट फील होता है?
बिल्कुल नहीं. I enjoy surgery is my passion.
अच्छा.
It's the best feeling for me to be in theatre. If I'm not in theatre, I'll be restless.
अच्छा.
It gives me mental peace. It is like connecting with God. It's
Meditation.
it's like a meditation for me, because it's a complete silence in theatre. Me, that heart, and him. I remember him for my music. In my theatre, I got 350 hours of collection of music.
Acha. And what kind of music are those?
There are all kinds of music, right?
Okay.
From party music to peaceful music,
To
mantra
devotional.
music, bhajan, and those musics got a soothing effect on me and my whole team. There's a pin drop silence. If you enter the theatre, there are many doctors who have entered the theatre and they said, Dr. Kaiche, can you give your playlist to us? Soothing effect.
So it's just that the heart, Dr. Kaiche, and God. These three people talking.
It helps me to connect to the God, to meditate. So that's the reason I keep going to theatre every time. I want to go to theatre every time. And एक मराठी में बोलते हैं, मैं बोलता है तुमको, देह मतलब जो तुमको मांगता है, ध्याता मतलब मैं, और ध्यान मतलब मेडिटेशन, ये सब तीनों चीज जब एक लाइन में आते हैं ना, then there is no difference between you and that spiritual power.
Wow.
You are aligned to him.
Oh my God, I'm getting goosebumps.
So that alignment, that goosebumps I get in theatre. You should start watering in your eyes. That is the connection you should have when you are operating in the theatre. So that connection I get for a second, fraction of a second. But that connection, that charge which gives me, I can stay on for whole day or maybe month or so.
Lovely.
When I try to get to that place.
It's really lovely to see this side of the surgeon, which many of us and your patients might not even know. So there are a lot of young cardiologists, young cardiac surgeons who take you as a role model. So what message do you have for them? Because everybody wants to be Rahul Kaiche. So what does it take to be Dr. Rahul
Whether they
Kaiche?
want to be a Rahul Kaiche or not, I will ask them to be a good human being first, for a good doctor, and secondly, be sincere in your work, have some integrity. They don't see, people compare coming to doctor as going to theatre. Patients do spend money in theatre or watching movies, and then they will come to us. They don't want to spend money. They go to theatre for recreation, for the enjoyment. Here they come to me or doctor for the suffering. So
True.
always everybody feels कि somebody is making money on my suffering. Of course, doctor has to make money
And who will pay his bills?
yeah, bills and everything, and he's dedicated his peak hours of career when everybody is enjoying in a hospital.
Also, sir, I strongly feel, I agree with you on this. And, everybody sees this part of it where they say that, doctor is charging so much for this. But do they see what doctor is not charging for and what doctor? Because every doctor has done something back for the society, because that's the main part.
Doctors are doing so much to the society that people must not be doing on 1% what they are doing to the society.
Exactly.
It is not doctors' only responsibility for doing society. It is
True.
every human being in this planet for the to do for the society.
So when you are saying this, look into the other
I must
aspect
be
of it
seeing,
also.
I don't know how many patients I see free in the OPD.
Yeah,
in a day,
nobody has account for that.
Yeah,
nobody has account for
nobody has
that.
account for that.
But
And how
everybody
many
will
people
have
are
account
giving
on
free from their shops or from their stores? Nobody gives free anything.
Nobody gives it free. But
So
they are not
it's
to
a
be
myth.
blamed. Yeah.
It's an irony actually.
Yeah.
For the
It's a very unfortunate thing.
unfortunate thing.
Okay, sir. So now moving on to the next segment, which is I have few questions, and which can be my myths or facts or rapid fire questions. So I'll read those out and let's bust some myths today. Bypass surgery is only needed after a heart attack.
No,
Myth or fact?
it's a myth as well as a fact, because bypass surgery is required if after heart attack only we do angioplasty or bypass, or we can do it before heart attack. So if you do a health checkup, proper health checkup, but not every heart attack you need a bypass surgery. Sometimes you can undergo angioplasty also, and sometimes you need bypass also after heart attack.
Stents are always safer and better than bypass surgery. Myth or fact?
It's a myth, because both bypass and angioplasty are safer. In fact, I will say bypass for long term is better, because in the previous question I answered your question, because we join a new artery way beyond the block where the artery is normal. So even the blockage keeps increasing, the bypass artery keeps working very well. So, and especially if you are using bilateral mammary arteries, that is arteries under surface of chest wall, those are the last arteries in your body to get blocked. Secondly, the size of those arteries is 2.5 to 3 millimeter. They can grow up to 6 millimeter when you put it on the heart. The example I want to give for this is why mammary arteries are better than the vein grafts or the radial artery, because these mammary arteries supply blood to the females in the breast. So the blood flow in this mammary artery in the female is 150 to 180 ml per minute.
Acha.
So when the female is breastfeeding a child, the blood flow goes up to 600 to 800 ml per minute.
Okay.
That is the beauty of that mammary artery. They grow in size.
Acha.
So when I'm putting this artery on the heart and the patient is exercising, the size of the artery will grow, increase in size. So
Acha.
the chances of getting this artery is getting blocked is very low.
Low. Okay. Women don't need to worry about bypass surgery as much as men do. Myth or fact? Please say fact.
This is fact. This is a myth and fact both, because females till their menstrual cycle is going on, they're protected from having a heart attack.
Yeah, that's there.
Yeah. But after the menstrual cycle is over, that is after postmenopausal, the incidence of heart attack in male female is same.
Same, correct. Okay. CABG is a last resort, only when everything fails. I think I know the answer, but still.
CABG is the last resort. I won't call it a last resort. CABG is if angioplasty fails, then CABG is the only option, and CABG can also be a first option.
Yeah, as you said, right? I mean, if there is some finding in the regular checkups or something like that, CABG is a choice which the surgeon
patient has
makes.
to choose, and surgeon has to convince the patient why it is better.
Yeah. A patient question that you have been asked 100 times but never get tired of asking.
मला कसं झालंय?
Okay.
Why me?
Which is the denial.
And second thing is, मला काहीच त्रास होत नाही.
अच्छा.
Patients do land up in the ICU, and when you ask them त्रास काय होतो, मला काहीच त्रास होत नाही. As if I have gone to his house and asked him to come and
get the surgery done.
Get admitted in the ICU as if it's a garden. So I don't. Our Indians are always in the state of denial. You don't accept things.
अच्छा.
Even if he was
कि मेरे साथ तो हो ही नहीं सकता.
हुआ तो भी मेरे को क्यों हुआ?
मेरे को क्यों हुआ?
So this is very difficult to answer them, and they are always in a state of denial. They don't want to get convinced only. कि I will require this angioplasty or bypass.
अब मुझे तो कुछ हुआ ही नहीं था, मैं तो
I
ठीक
was
था। हाँ, मैं तो
normal.
ठीक
If you
था।
ask them diabetes, normal diabetes. If you got normal, why would you come to me?
True.
Hypertension, normal है।
Normal है, वो तो कब से है,
पर
सब ठीक है।
बीपी के लिए तुम गोली ले रहे हो, इसलिए तुम्हारा बीपी नॉर्मल है। So accept the fact that मेरे को ब्लड प्रेशर है, मैं गोली ले रहा है, then you will have better results of treatment. If you are always in a state of denial, you will not get results of the treatment.
True, true. Okay. In your opinion, what makes a great heart surgeon?
Sincerity towards the patient, integrity. He is my patient. I should deliver him best. And upbringing of the person also very matters for a person to become a great heart surgeon.
What keeps you grounded after a long day in the OT?
That is my upbringing by my parents.
Okay.
It's that is how I am born and brought up by my parents. Never to go become egoistic, never to get things in your head, and always accept that thing that if somebody else was in my place, he would have done the same thing. So
can I call it a sense of gratitude towards
course,
what you
yeah,
have,
yeah.
right?
God has given me something, so I have to deliver it to the patient.
True.
That is the thing. Except anybody else who was, if you are in my place and my parents were trained you, brought to you the way I have been brought up, I think you have done the same thing.
That's so
And
nice
I
to hear
consider
that
myself
from you.
lucky that I was born in this family, and God has given me this gift of giving life to the patient. So this thing should not go in my head. It is a gift given by God to me. So I should keep it. That keeps me grounded and keep doing my things.
Sure. One thing patients do after surgery that truly speeds up their recovery. Or I can say, what is one thing that patient must do after surgery that will recover, speed up their recovery?
First of all, he should be mentally strong, be positive that I want to get operated and go home, as doctor said, on day 5, day 7. So if he's that, if he comes with that thing in mind, he'll recover faster. Whatever advice the physiotherapist or the nursing staff or doctors are giving him to exercise, he should do those exercises as much as possible rather than just sitting on the bed or lying down on the bed and taking services from his wife or children's. It's the wrong thing. He should do his own activities by himself, try to do all his activities by himself. Unless it is very hard, he's very sick or he's
Really not able
to do it. But otherwise, a farmer can do farming, a laborer can do laborer's job, and a office person can do office job after bypass surgery. He is not fought a war and gone home that he needs rest. He just had a bypass surgery. So don't consider it a second life or third life. It's just a routine surgery and start doing a routine
Treat it
activity.
like a routine surgery and try to get back to your normal routine as well.
activities.
So my last question is, Dr. Rahul Kaiche right now is giving an advice to the younger self, which is younger Dr. Rahul Kaiche. So what that advice would be?
Be yourself
Okay.
and be happy from inside. If something is giving you happiness by doing something, keep doing that same thing again and again. And be sincere in your work. Give 100% to whatever you're doing. It is not 35% passing in exams or 50% passing exam. Here you have to pass 100%. So you have to give 100% to get 100%.
Okay, that's beautiful. So what inspired you to take this cardiology? Come into
Cardiac
cardiology.
surgery.
Yeah. What inspired you to be
During,
CABG surgeon?
during my MBBS days, I wanted to become a surgeon. There was no
Acha.
doubt about it. I had a passion for doing cardiac surgery, general surgery.
In general surgery.
And then doing general surgery, I think doing my internship, I had been to Bombay Hospital
Acha.
to see my cousin who had a head injury.
Acha.
And me and my father had gone in the ICU. It was a night time. And my cousin had a very bad head injury. Nobody knew his father. It is my mama, myself, and all the relatives are not knowing whether he'll come alive or not. And Dr. Bhagwati, who was a neurosurgeon, he came out of the operating room and saw. It was like a divine thing coming from the operation theater and explaining to everyone that I did my job and he is going to take care of everything now. So that thing struck me like anything, and I decided that day I'll become a cardiac surgeon or a neurosurgeon or an oncosurgeon. Three things I had decided that time. And cardiac surgery was the only thing which was giving 100% result. So then I decided I'll become a cardiac surgeon during my MS days because it was giving 100% result. And still we are trying to do 100% result. Patients become normal after surgery.
Yeah,
That was the thing.
true. That's lovely. So before we let you go, what would be that one message that you want to give out to the audience, loud and clear, who needs a CABG surgery, or one thing which you want to talk about CABG surgery to all the patients out there who might be watching this podcast, needing one CABG in future or something like that?
Whoever has been advised bypass surgery, they should ask the doctor to go for total arterial bypass grafting, that is using both the arteries from the chest wall. And my second advice will be, don't think that you are the sufferer or why me, मुझे क्यों हुआ ये.
Don't stay in
It
denial.
is your destiny. So accept the fact that you got a heart disease, accept it and go for the surgery or angioplasty, whatever has been advised to you. And three things I will tell them for not to have this heart disease.
हाँ जी.
Because if you had a heart disease, if you had a bypass or angioplasty, your next generation will have this disease 10 years earlier, a decade earlier. So
Acha.
what you should do is, eating habits should be improved. Don't try and eat fried foods. Stay away from fried foods. At home, if you are using oil, try and use only half a liter of oil per person per month. Say no to white, that is dairy products. More to green, all green leafy vegetables, salads, fruits. That should be your 1/3 of the meal should be that. And exercise is the most important thing. Every day, at least 5 days in a week, you should be exercising whatever suits your body. Walking 5 kilometers in 45 minutes is the best exercise for the heart. If you want to do cycling, you can do cycling. If you want to do swimming, you can do swimming. But at least some kind of exercise you should do, which is very important for your to prevent you from having heart disease, or if you're diabetic, to decrease the sugar level or decrease the blood pressure level. Exercise does help for everything. And stay happy and stay contented. Don't compare yourself with other people.
Thank you, sir. On that note, thanking Dr. Rahul Kaiche once again to give his precious time for this podcast, and wishing you all the best for all the future cases. May you reach out, may more and more people who need such surgeries are able to reach out to you. Signing off, Dr. Tushita, Sahyadri Health Talks.